Hello everyone. So I'm going to cover the topics mHealth, health literacy and infection management. So the contents which I'll be covering mHealth, type of mobile healthcare apps, tool of mHealth, AI application, disadvantages, health literacy, telemedicine, tool of AI application, infection management, role of AI in infection management, tool of AI application. The first question which comes in our mind, what is mobile health? So, it is a term used for the practice of medicine and public health supported by mobile devices. So, it's an abbreviation for mobile health because we are using mobile devices in this. So, it's most commonly used in reference to using mobile communication devices such as mobile phone, tablet, computers for healthcare service and information. So the application include the use of mobile devices and basically three things: collecting community and clinical health data, delivery of health information to practitioners, researchers, and the last one is real-time monitoring of patient vital signs. So in this slide, I will be telling about the types of mobile healthcare apps. So the first one is application of assistance in diagnosis, and these are symptom checkers, digital imaging, lab result review. So the second one is application for reminders, prescription management, appointment reminders. The last one is application for remote monitoring. So in this, the examples are live scan for patient with diabetes, remote heart monitoring, ECG viewer, oxygen level remote check, and telehealth service. So the most important thing which works in mHealth, these are the sensors. So these are the wearable can be integrated into the various accessories such as garments, hats, wristband, socks, shoes, eyeglasses. So basically, it comes directly contact to our body and gives the signals to our phone. So the sensors works on three simple steps. The number one is measure your physiological parameters such as blood pressure. Like I have said, it is in the directly contact with your body, so it can measure your blood pressure. Communicate with your phone, okay, your tablet. And the third one is alert based on the analysis of collected data. So basically AI is used which analyze the data and give you the signals, like not signals, but it will alert you based on your data if it's harmful for you. Like if blood pressure is high, then it will alert you like that. Huh. In this slide, I'm going to tell you about the smart ECG monitor. So basically, it is a three-lead wireless ECG. Send the ECG readings to the user Android smartphone via Bluetooth. So the patient clinician can then access the readings. Next is stethoscope. So in this, the model of 3M Littman. Um, this is the stethoscope which send information wirelessly to a PC. Same, this pulse oximetry can work with the help of Bluetooth. This is the another examples. Heart rate monitors, body monitors. Same, these are wireless and send signal to your phone, smartphones. So the use of GPS in mobile health. This is very important in the mobile health because it can track you, and even you can easily track hospital and specialized doctor for a specific purpose. And you if you need to press your panic button in mobile phone, and an ambulance will be sent to you by the nearest hospital. And so what is remote surgery? So it's an ability for a doctor to perform surgery on a patient even though they are not physically in the same location. So like in this figure, you can see like the doctor is in another place, or like the surgery surgeon, and the patient is another place, and they are connected via internet, and the robot will perform the surgery. So the examples of AI application in mHealth. So The first one is IBM Watson Health to assist clinician in cancer diagnosis and treatment planning. Ada Health, which is an AI chatbot for symptom assessment. The Google DeepMind, developing AI algorithm for the early detection of eye diseases and diabetes retinopathy. So the disadvantage is of mHealth, privacy of the patient health information, okay, security issues and lack of information control. Not all people use smartphone and network connectivity because some people are not using phones in remote areas. So that's why, and it is complicated for some peoples. Security issues like it can use your data, personal data, and like same privacy also. So the next topic is health literacy, which is also e-health and telemedicine. So what is telemedicine? So telemedicine is of three types: point to multi-point, multi-point to multi-point. In point to point, one patient can connect to another doctor. In point to multi-point, one patient can connect to the many specialist doctor. And in multi-point to multi-point, several patient can connect to several different specialists. So it include mHealth, big data, telemedicine, clinical information system, integrated network. So these are the domain of objectives. So the objectives is the information management, patient information, medical data, which are the signs, symptoms, and test report, etc. Appointment scheduling, which is the very important part in this eHealth. Okay, the archival and retrieval of patient record. It can store the data and you can retrieve your data if you want in future. Low cost solution using ordinary telephone lines. So through the public healthcare delivery system, service it can provide service to large population. And for it can development and knowledge based system for decision support, for training and education. So it can provide you direct patient care, sharing audio, video, medical data between patient and a healthcare professional, rendering a diagnosis, treatment plan, prescription, or advice. This might involve patient located at a remote in a physical office so they can connect. So this is an example online care, like like in this you can see how the patient can connect with their specialist doctor, and they are using the chat box, and they are also connected via video call, and it's very easy for them to connect. The another one is ASAP urgent care. So what is remote patient monitoring? So it uses device remotely to collect and send data to a monitoring station for interpretation. Home telehealth application. Devices to capture a specific vital signs such as blood pressure, glucose, ECG, or weight. Supplement the use of visiting nurse. Examples of the AI tools being used in healthcare. So the AI-powered chatbots and virtual health assistants such as AdaHealth, like I have explained it earlier, UNMD, Boy Health, provide personalized health information guidance through conversational interface. This is the example Alive ECG, Wi-Fi smart scale. It can measure your weight and it can give you the advice. Like if your water content is low, it will give you a message like you should need to get yourself hydrated. Otoscope, blood pressure monitor, Bluetooth stethoscope, blood glucose meter, like this. So the last topic is infection management. So before coming to this topic, we should know about what is infectious disease. So these diseases are caused by microorganisms belonging to the various class like bacteria, virus, fungi, parasites. So these pathogens are transmitted directly or indirectly and can lead to epidemic or even pandemic, like we have seen the case of COVID-19 already. So basically what AI will do, it will create a algorithm, the data including behavior, demographic and epidemic disease trend to create a model of disease spread that captures underlying population dynamic and contact pattern between people. So that's how AI work. It will create an algorithm and based on that algorithm, the whatever input data you will give to the AI, it will give you the output. based on that algorithm. So it refers to the systemic approach taken by healthcare professionals to prevent, diagnose, treat, and control infections in individuals and population, minimizing the spread of infection agent, reducing the risk of infection-related complication, and promoting optimal patient outcome. So the role of artificial intelligence, these are the early detection and diagnosis. AI can analyze the medical data such as symptoms, laboratory test reports, imaging, the scans of like X-ray scans and all, identify signs of infection. Machine learning model can detect patterns, specific infection, and aiding in early diagnosis. So the next one is antibiotic stewardship. So can AI system can assist healthcare provider in selecting the most appropriate antibiotic regimen based on the factors such as microbial resistance pattern of person and the bacteria, patient history, and local guidelines. Predictive analytics. So it can forecast the likelihood of outbreak of healthcare settings by identifying high risk patient or areas. The next one is treatment optimization. It analyzes the vast amount of clinical data and personalized treatment plans for individual patient, include optimizing doses, duration of therapy, patient drug interaction, and improving treatment outcome. That's how it improve the treatment. So how AI helps in infectious disease? So one of the way that AI can help to prevent infection disease are the surveillance and identification of emerging infections and their potential source like vector and transmission route. Okay, so AI can help to treat infection disease by optimizing the antimicrobial therapy and infection prevention and control measures. Okay, so AI can use machine learning to analyze data from clinical trials, electronic health records, and pharmacokinetic and pharmacodynamic models. So these are the examples which are used by the professionals. The IDXDR. So this is the first FDA approved diagnostic system that detect diabetic retinopathy, which is a complication of diabetes. Um, so it collect the retinal images while not directly related to the infection. It showcase the potential of AI in medical diagnosis. The next one is Butterfly IQ. So it is an AI-powered handheld ultrasound device that assists healthcare providers in imaging various anatomical structures, including those affected by the infectious disease, like in pneumonia. In the case of pneumonia, okay, so these images are of these um, tools. The next one is BioFire Film Array System. So it is an automated multiplex PCR system that rapidly detects a broad, ra- broad range of infectious pathogen, including bacteria, viruses, and fungi. Basically, it's work on PCR, polymerase chain reaction. So, like the pathogen will multiply in this, and it aid in the guiding the antibiotic therapy disease and providing the tabling pathogen identification also. The next one is Outbreak Near Me. So it is developed by the Health Map. Outbreak Near Me is a mobile health app that uses AI in natural language processing to aggregate and analyze disease outbreak report from various sources, including news outlet and social media. And it provides a real-time alerts about infectious disease outbreak. So, like this is a news article in which AI finds the pattern of cholera. So, in this, like among 76 people in Bangladesh, one third of the sample developed cholera. So AI help in getting the algorithm like how this cholera is spreading among these people from one infected people. So this is how AI help the practitioners or researchers. These are the references. Thank you.